Hello everyone and welcome to my presentation. My name is Cecilia Loya and I will be discussing about health issues in the Latino community. First and foremost, there is a disclaimer for this presentation. The information in this video is for informational purpose only and was produced for a class project. The creator is not a medical professional. The student, faculty, and university do not guarantee the accuracy nor reliability of the content, nor should it be a substitute for a professional medical advice, diagnosis, or treatment. If you have questions about a possible medical condition, please contact your physician or qualified health provider. Never delete seeking treatment nor disregard the advice of medical professionals due to information you receive in this video. Now, to begin this presentation. Based on cultures and genders, the risk of having health conditions vary drastically. Within the Latino community, there are many who are immigrants, which can affect the probability of risk of diseases based on their gender and socioeconomic statuses. Of the many health issues, there are 5 common health issues among the Latino community. These common health issues are blood pressure, type 2 diabetes, which relates to cardiovascular disease, obesity, asthma, and liver disease. As stated by Velasco-Mondragon, the Hispanic population in the U.S. is disproportionately affected by obesity, with 42.5% of adults currently classified as obese. This means that at least 50% of the Hispanic population have poor lifestyle choices. To continue, Guadalupe states that Hispanic are 50% more likely than non-Hispanic whites to succumb to liver disease and complications from diabetes. On the other hand, other Latino communities are also affected by these lifestyle choices. As mentioned by the Office of Minority, Puerto Ricans suffer disproportionately from asthma, HIV, AIDS, and infant mortality. Mexican Americans suffer disproportionately from diabetes. To follow, gender life expectancy also varies among the genders in the Latino community. According to the CDC Hispanic Health website, the average life expectancy of Hispanic is 81.9 years. As for women, it is 84.1 years, and for men, it is 79.6 years. This also then shows the correlation between the 10 leading causes of death and which gender is more prone to it. As depicted in the graph, for Hispanic, diabetes, chronic liver disease, and cirrhosis is one of the many leading causes of death. The immigration statuses of the family also is important and influence the probability of visiting the doctors. As stated by Machado, Obamacare would not be transferred to immigration services. The 5.5 million American born children of undocumented parents may find their families avoiding Obama sign-ups out of fear of exposing their status. A lot of these circumstances and barriers have to do with the occupations of these immigrants. Many are exposed to environments that increases the probability of health issues. Undocumented immigrants are particularly vulnerable since they face unique risk and exposure to traumatic experiences before, during, and after migrating that put them high at risk of mental distress, as mentioned by Bucay-Harari. As also Garcia mentions in that article that among female U.S.-born Mexicans, foreign-born Mexicans, and island-born Puerto Ricans spend their late life years with more morbidity than whites. The trend that are being seen with these health issues come to show that there are barriers that the community faces on a daily basis. The American dream can cost our health if not given the right tools to prevent these deaths based on our lifestyle. As any other community, minorities have suffered more based on their health policies than others. Not only are immigrants afraid that physicians will disclose their immigration status, but there are also other barriers that contribute to this. These barriers are language, cultural, lack of health insurance and preventative care, household incomes, and occupations. Not only are older generations facing these barriers, but also Latino children. This then creates a trend where children grow with the mentality that they do not need to visit the doctors unless their condition is worse than expected. Vargas mentioned that Latino children represent the tip of immigrant health disparities in the Latino population that will be largely determined by differential environmental exposures and the intergenerational social stratification patterns of the U.S. society. But what many do not know is that our lifestyle behaviors are what influences these health risks. This is where the community lacks education and can be taught right from school. Based on the lifestyle medicine websites, changing unhealthy behaviors is foundational to medical care, disease prevention, and health promotion. This community is one of the many that will visit the doctor based on their health. Many individuals will stick to home remedies to cure their sickness. Latino immigrants are probably the most medical underserved group in the America, as mentioned by the Joint Center of Political and Economical Studies in 2004. The barriers that are seen through this community have an influence in not only in older adults, but also in young Latino children. At this point, you might ask yourself, what is our community doing or country to help the Latino community? According to my research, there are educational opportunities, cultural and language competency training, funding, and technical assistance to regions with new immigrants. These are some of the solutions that focus on the health of the community. Not only is it important to change our lifestyle behaviors, but it's also important to build a strong, healthy community to educate every individual. Working to build capacity in the community to use health workers, promotores de salud, to help improve the health of Hispanic communities, as also mentioned in the Hispanic Health website. This website shows the importance of building a strong connection with community health workers, which can benefit many Hispanic immigrants. This website also mentions how important it is to make an effort to follow proven health tips such as quit smoking, staying on the medicine to control blood pressure and cholesterol, and maintaining a healthy weight by taking at least one brisk 10-minute walk 3 times a day, 5 days a week. Our lifestyle behaviors influence our health, even when the communities have to have healthy behaviors. Other barriers can come across which influence the probability to seek medical help. In regards to health, each condition can differ with age, gender, and cultures. The key factor in order to maintain a good lifestyle is being educated on the subject and taking action. Our lifestyle is affected by many factors like socioeconomic statuses, gender, and cultures due to beliefs or religion. Society and parents are important role models for children to maintain healthy lifestyle, which these habits can continue through their lifespan. I hope you enjoyed this presentation and thank you for listening.